Assalamu alaikum wa rahmatullahi wa barakatuh, everybody. Welcome to the mental health first aid training with WISER. And it is my pleasure and honor to be your moderator today. My name is Hane, and I currently serve as the executive director of the Islamic Center of Greater Cincinnati. It's in Westchester, Cincinnati area in Ohio. And we have a weekend school. And then next door, we also have a full-time school. The weekend school is on Sundays, and we have about close to 400 students. And we've, just like what you're dealing with, we have been encountering situations where, people have been asking as to how does mental health relate to what I do as a Sunday school teacher, as a Sunday school administrator, or even maybe as a parent of a weekend school student. And, given that I work in the environment, I would probably say I will let Brother Shafiq speak more about that. From my perspective, all I would like to say is if you happen to be in a space where our youth interact with teachers, interact between themselves, with one another, or interact with anyone else, then this training does relate to you because all of those factors do come into play when you are in those spaces. So it does relate to what you do. And alhamdulillah, we have an expert available to us tonight, inshallah, to walk us through that, to do a presentation, speak about this, the mental health training, as well as the aspects that go along with it, how it relates to what we do at the weekend school. Brother Shafiq Ahmed is an accomplished public health professional with an MSPH, with over a decade of experience in healthcare research, biosecurity, and emergency management. With that, he also has a robust background in pandemic preparedness, health security, providing strategic support to agencies at the U.S. Department of Health and Human Services. And can everybody hear me? Good.
Yes.
Okay, alhamdulillah. So part of his wealth of experience and skill set is advanced data analysis, strategic project management, stakeholder engagement, successful leading of multi-year initiatives, and overseeing cross-functional teams to achieve high-impact outcomes. Brother Shafiq also has skills at fostering collaboration across diverse sectors, including nonprofit organizations, international organizations, community groups, schools included, to drive public health initiatives. Currently, as he serves as a public health management consultant, specializing in drug shortage mitigation and policy analysis during public health emergencies, as well as enhancing organizational resilience through strategic planning and evidence-based recommendation. So as you can see from his bio, we have with us today someone with whose experience, the breadth of experience is commendable, and is an expert in this field, who's gonna, we'll have the pleasure to hear him talk about mental health, first aid, and all that comes along with it and how it relates to what we do, inshallah. Without further ado, I would like to introduce Brother Shafiq to go ahead and take over the floor and take us through this training, inshallah. Jazakumullah khair. And just quickly, housekeeping items just quickly. Inshallah, if you have any questions, you can use the chat. And then I don't know what Brother Shafiq's preference is, whether to wait until the end for all the questions to come along. I think that probably would be better because we have until 9:30 only, so about an hour and a half. And right now we have about an hour, 20 minutes. So maybe just hold the questions until the end, and then we can ask the questions, inshallah. Jazakumullah khair. Brother Shafiq, please go ahead.
All right. Assalamu alaikum. Thank you so much for that introduction. Let me go ahead and share my screen. All right. Just wanted to check if you wouldn't mind letting me know if you could see the presentation.
Yeah, we can see it.
Okay, fantastic. So Assalamu alaikum, and thank you so much for having me. That was a wonderful introduction. I'm very humbled to be amongst educators, especially working in the Islamic school space. One of the things that was mentioned was the my work and doing work in pandemic preparedness. My relationship with AMP goes a long way, and one of the things I had the opportunity of doing was working with AMP and a national coalition of Muslim organizations to really tackle the COVID-19 pandemic with the Muslim community. One of the things we saw deeply was the fact that the Muslim community was often not included in research studies, not included in discussions of how those policies and changes to how we see education, congregations, how that impacts the Muslim community. So I had the honor of working with Islamic schools and organizations to help them understand and navigate those COVID policies. And of course, one of the challenges that definitely came out of the COVID-19 pandemic was a sharp increase in the number of mental health issues affecting the Muslim community, not only just adults, but also children as well, including school-age children from elementary school all the way up to high schools and beyond. So really, my current position, I'm the mental health program manager with the American Muslim Health Professionals. And one of the things we're working on is the opportunity to expand our programming, expanding our efforts to really delve into the conversations to have in mental health with the Muslim community. And we'll get into it shortly, but we all are very much aware of the stigmas around mental health, both from within the Muslim community and within various cultural sub communities within the Muslim community in the United States. We've heard instances where people have been told, you can pray it away, read Quran, follow the Sunnah, and these are all ways in which your mental health will become better or whatnot. But really, the reality is that both Islam and our faith go hand in hand in how we deal with mental health. The Prophet ﷺ told us that we need to seek professional help in whatever it may be, people who are experts, people with knowledge, right? So it's very important to have this sort of discussion with the Muslim community, especially with Islamic school teachers, whether you are part of a Sunday school or a full-time institution teaching children. So a little bit about ourselves. So American Muslim Health Professionals, we've been around for over 20 years, and listed here our mission and vision. There are three areas that we focus on. One of them is policy and advocacy. The other is professional development, and the other is mental health. So from the policy and advocacy standpoint, we have a team that works on identifying issues, but not only at the federal level, but also sometimes at the local level, to be able to address and advocate for instances that are promoting the Muslim health and well-being, as well as issues that are important to us. So we also work on professional development. So we've held every conference that we have had last year. And it's something we plan on doing again. The conference itself focused on bringing greater attention to mental health and health-related issues within the Muslim community. So that's another thing we do. We also have local chapters in Chicago, Texas, New Orleans, and the DC, Maryland, Virginia area. So our mental health program, just wanted to show you a few things. One of the things that we do is mental health first aid training. These are things that we gear this training towards, teachers, parents, imams, youth leaders, and other community leaders. We try to provide a culturally religious and responsive mental health education through this training. In addition to the first aid trainings, we also do mental health advocacy, hosting roundtables, having discussions, and meeting with our elected leaders to advocate for greater support of mental health, not just in the Muslim community, but a broader discussion with communities of all faiths, all cultures, as mental health does affect everyone and it's not targeted for a single community. Like I mentioned, we also have hosted some conferences. We are active within the pool of other Muslim mental health organizations, so really supporting each other and providing resources to each other, but also to the Muslim community as well. So mental health challenges. The Muslim community is very diverse, and that's something, we can definitely, I know I can't see everyone on camera here, but just looking at our masajids, right? We go and when we travel to other areas, the Muslim community is not homogenous. And as a result, there are areas, especially not just metropolitan areas, but within the diverse realm of our Muslim community, there are, people who are suffering from mental health conditions. In a study from SAMHSA, 1 in 5 adults in the United States live with some sort of mental illness. And this could be ranging from anything as from depression and anxiety to other instances of bipolar disorder, eating disorders, and many others. So, but when it comes to the Muslim community, that increases to a lot more because of the stigma surrounding mental health. There are far fewer, opportunity, or Muslims are less likely to get professional help than non-Muslim Americans in the United States. And so what happens is that 50% of Americans live in areas where there is a mental health professional shortage. So what that means is that it becomes even more difficult for individuals to seek care from professionals. So one of the things we try to do is support Muslim community-based health organizations that do provide mental health services. So that could be something that's locally done or in a larger area. So one of the things we try to do in the mental health first aid training is bring about the importance of that understanding of the Muslim community. There are certain things that mental health providers may not fully understand when it comes to dealing with Muslims who are seeking care. And having that cultural competency is very important to have. And one of the things that the mental health first aid training does with AMP providing it is we provide that lens and that context to attendees. So what is mental health first aid? One of the things I always, when I do talk about this, I liken it to CPR. CPR is a very important skill to have. It enables an individual, anyone, to see if somebody is having shortness of breath or they're unable to speak, to identify signs and symptoms that would necessitate, that would indicate medical emergency. And as a result, we act on that. We will call 911, we'll do chest compressions, etc. With mental health first aid training, it is similar in that same idea, except it gives us additional information in which how we can readily see someone who is struggling with a mental health condition. So with those signs, they aren't always apparent, and they're not, we don't see shortness of breath. It could be a person having a panic attack, but it's not the same as seeing someone who is suffering from depression. What are those signs and symptoms? And with younger individuals, it's sometimes a little bit more, even more difficult to identify. So really what we try to do with the mental health first aid training is empower educators like yourselves and train individuals to be able to identify what these sometimes signs and I don't want to use this term symptoms because it's not really, symptoms, but like indicators that would show that a person is having a difficult time. So the MHFA program in itself is designed, and actually, it's going to be in the next one. So I'll come to it in a second. So the MHFA program itself is evidence-based. It's based on research, and it was designed by a national organization called the National Coalition for Mental Well-Being. So they use this, from research studies, they found this educational training program that allows individuals to identify and, step in as early intervention about, mental health, substance abuse, and many other topics. So that's where AMHP has come in. In 2018, we started our mental health first aid training program. And alhamdulillah, ever since then, we've had a very successful effort. We've had, we started off in Chicago, in Illinois, and we've expanded that to, I'll show you in a second, to over 30 states across the US. And, we're continuing to work to expand that. So the question is, who should get certified? And, we would say everyone. It's important for, parents and family members to be able to see, it helps them to better understand, any sort of indicators within their family members or in their children or even themselves. Because sometimes you might, feel sad and you might say, okay, well, I'm just having an off day. And what you won't realize is that really you may be suffering from, anxiety or depression, things that you might think was, fairly normal, but in reality, it could be something a little bit more serious, and this sort of training will help you to go get, support and help. We also believe that, religious leaders need to be able to, should go through this training. It's going to help them understand the struggles and challenges that their community is going through. Imams need to be able to identify that, if a person is suffering from depression, like I mentioned, it's not you pray it away or read the Quran and it'll go away, but really there has to be some sort of effective way in which they can provide the spiritual support, but also recognize that, they themselves will have limitations and that it's important for them to have the individual get help. So the training will also provide support on how to do that. The training is important for medical providers, law enforcement, teachers, community leaders. Here's a great quote from the former U.S. Surgeon General, Dr. Vivek Murthy. So there is a lot of emphasis on well-being, and being able to achieve that level of well-being, you have to be able to ensure that you're okay, and then be able to understand that and recognize that if somebody needs help, you're able to support them and give them the help that they need. So the mental health first aid training, we have trained over 2,000 individuals across the US. And the highlighted states here show where we have done trainings. We have done over 250 trainings in 30 states. We have over 12 certified instructors, and we're looking to, train some more instructors to be able to carry out this important training. So this is where we believe the importance of mental health first aid. We try to, as an organization, optimize and enhance our training program by diversifying it with the organizations that we partner with the individuals we have doing the trainings and things like that. We also see the importance of the needs of the Muslim community and the shortage and the gap that's there in providing mental health services to the Muslim community. And so we are actively working towards, filling that gap to ensure that people are getting the help that they deserve. Um, and the other thing we believe is, we want to engage all sorts of types of organizations, just like WISER, that will utilize this training to provide support and a needed service to the Muslim community at the local level, and to be able to have these important conversations about mental health, not just as educators like yourselves, but to have those conversations with, imams, and saying that, hey, we're seeing this trend in our youth, and we want to address it, and to have those constructive conversations of, well, how do we get that help? How do we set this up? Not and it may include bringing in additional services that will support the youth, the children in our communities. So that's something we firmly believe in. And we've had all sorts of partnerships. Here's just a few. We want to continue to improve ourselves in the trainings that we do, as well as an organization. So I'm going to stop it right here, and just and open it up to questions that you might have. So Henry, do we want to use the chat or use the Q&A function?
Either way works for me. The Q&A question, I think, might actually work better. So if you can activate that, that would be great. Yeah.
So please, if you have any questions, please feel free to add it into the Q&A section. Okay, let me start with the first question we got, like, how do we incorporate into weekend schools? One of the things we can do with, and I think I can get into the other question, is the training any different when any different when for Muslim schools and communities? So because we are a Muslim organization doing the training, we are using the content from a national organization. And so because of that, what we do is when our instructors come in to teach it, they are teaching it to you through a Muslim lens. So when we do talk about, signs and symptoms and things like that, we may not delve into the Islamic side of it, right? We know there are hadith of the Prophet ﷺ that talk about, how to deal with anxiety or troubles or grief, right? So those are, things that we want to be able to, from these trainings, train our imams or educators or whoever it might be to understand those signs and symptoms. And in doing so, they can take that lens and in a sense, be a cultural, what's termed as a cultural broker. So they're taking that information and translating it into the context of the Muslim community. And in doing so, you're able to incorporate into your weekend Sunday schools, or even your full-time schools themselves. So that's what that training is going to do. It's going to help you to identify whether, if a child starts getting withdrawn, doesn't participate in class, or maybe they might be acting up, again, depending on the age of the child, or how they're behaving. Maybe they've all of a sudden started becoming disruptive, or withdrawing and not responding like they used to. And again, these are just like anecdotal examples, but I want to emphasize that it's important that when you do this training, you can always take it back into your school or community. Zim, that's a very good question. Yes, a lot of people think that, mental illness is a weak faith, lack of prayer, and that's, something that's not something we shouldn't, put too much weight on. It's, in my opinion, it's not correct because, you can still, people can have like strong faith. If you look at the Prophet ﷺ, even during his year of sadness, even though it's termed as the year of sadness, it's really depression. The Prophet ﷺ was affected by depression. He also had anxieties. And of course, but where did he get comfort from? And again, we can say that, oh, well, during the time of the Prophet ﷺ, there weren't counselors, there weren't therapists and things like that. But he still sought help, sought comfort from people that he trusted. His wife, those are just examples. But here now what we have is that sort of stigma really, really affects, outcomes in our community. And it's really difficult for me to say that, a lot of Muslims, there's just so much, there's a lot of instances where suicide is involved, is because that's not, these sort of conversations are not happening. And I mentioned in the presentation that what we try to do is encourage the idea that both have to be dealt with, side by side. That it cannot be just the idea of, go read the Quran, it's going to take care of it. But really, we have to take time to get help, right? If I cut myself, and I'm bleeding profusely, do I go to the imam and say, please make dua that this bleeding goes away? Or do I, our instinct is we're going to go see a doctor. We have to see a doctor. I get into a bad car accident. I have broken arms and ribs. I'm not going to tell the ambulance, like, take me to the masajid. The imam's going to make dua and I'm going to read Quran and I'll be okay. It doesn't work that way, right? So, yeah, I hope that answers your questions, but that's a very important one. Be effectively, yeah. So the way we can address those stigmas is talking about it. And mental health first aid training does take those first steps into having those conversations. How long would the training be for weekend school? So, if you reach out to us, we will definitely work with you to provide the training. Typically, it's a whole day sort of training, about 8 hours. We have a option to do it virtually. And if we do it virtually, it'll be 6 hours, but we'll also include 2 hours of reading material that needs to be completed before the training itself. Sure. The director of ICOSF, if you want to reach out to me, I can definitely provide that to you in terms of what sort of items is covered. So, definitely, signs and symptoms, discussions about depression and anxiety, substance abuse. Those are just a few examples that are covered. Okay, so the question is, how is the digital world, especially social media, affecting the mental health of young Muslims, and what unique pressures do they face that others may not? That is a very good question. I actually want to make the preface that, I myself am not a therapist or psychiatrist. So a lot of this is based on research that, I've read on, and I would definitely encourage you to speak to a counselor that can better speak on this topic. But what I can say is that, social media is something where it's a constant barrage of information, right? So in the social media creates this idea of what idealistic, views are in terms of body issues, right? We know that body issues can affect women and cause eating disorders. And we've known that for a long time, but a lot of it has, accelerated with social media. But what we also don't pay attention to is the fact that it can also, eating disorders do affect young men. And we see them going to the gym. They're not eating as much as they should that will nourish their bodies. And they're obsessed with getting bulk, lifting weights, and they don't eat appropriately. That doesn't mean to say that the solution to that is forcing them to eat more. That will, cause other issues. But to get to your point with regards to social media, it does affect young Muslims, right? It exposes them to a lot of information that they're not aware of and maybe have not had the opportunity to have in-depth conversations of. But I would also, you feel free to reach out to me and I can connect you with someone who can, add more depth to your question, inshallah. What will the trainee be able to do after the training is completed? Sure. So as I mentioned, one of the important things of, mental health first aid training is that it enables them, an individual, to be able to identify and make decisions in terms of how to address, in the context of an education system, how do we address, a child's behavior? If it could be that they are, if they are acting up, if they are withdrawn, it's not the same for everyone. So for a teacher to be able to go through this training, and even physicians go through this training, right? Physicians are trained to be able to identify signs and symptoms and treat them. But the mental health first aid training is also important for someone, let's say, for example, in the ER. I had a conversation with a small health clinic in Detroit, and they want to have this sort of training for their new residents and interns that are coming in to treat patients. And they need to be able to identify whether someone is having a mental health crisis, right? And that's especially in adults. They could be coming in, and it may not be readily identifiable when coming into a clinic or anything like that. So with the context of educators, it allows the teacher to be able to identify that, hey, something is wrong with this child from a mental standpoint. They're not participating, they are withdrawn, or they're acting out, they're angry, they're throwing things, right? Things that we could say like, oh, we'll send them to the principal's office. But it may help us, these trainings will help to see how we can address the situation at that moment. But if it requires additional help, then it'll also empower the educator to reach out to whether a principal or a guidance counselor at the school, or if it may be that we need to bring the parents into the discussion and say, hey, something is wrong. And it may require that the child see a professional, a mental health, either a psychologist or a psychiatrist or some sort of therapist to provide additional support. Safa, that's, oh, sorry, I missed a question. So, Muslims. Yeah, so both Hussein and Safa, I would say with the mental health first aid training, it will give you the tools that you need to be able to have these sort of conversations with, a child, or with young Muslims who are, who might be navigating identities and struggling. So, yeah. And Hussein, just to kind of add a little bit more, that's where it is difficult. It's not going to be easy, but the MHFA training will help to support those navigating those conversations and the pressure that they might be feeling and how to kind of initially have those conversations. If it's something that a child is not reciprocating or communicating back, it might be that you may need to get additional support. Yes, there is a cost associated with the training. And I'm not sure, I don't have a name for the director, but if you want to reach out to me, my email address is mentalhealth at amp.us. We can set up a meeting and we can talk about those logistics costs and things like that. Let me see if let me put my email address in the chat room real quick. Okay. Yes. Zim, thank you for your comment. Um, so these are sensitive and complex issues. And, it's important that well, that's what the training is going to help us do. It's going to help us to navigate whether it's, having a conversation with a child or even with an adult, a young adult for that matter. So, we can't even, it's not the answer is not either you go see an imam or you go to a therapist, right? There is that stigma involved in our Muslim community, right? Um, when growing up, whenever we were hear someone having mental health issues, we would say, oh, they're pagal, or and it becomes this whole negative connotation to it. What we need to do is have that conversation and say that it's okay that a child is feeling sad or they're feeling anxious, but at the same time, having a professional help them navigate those feelings is something that a professional can do and a parent or an educator may not be able to do. But with the MHFA training, what that does is allows you to see that this child is struggling. I'm not sure exactly what it is, but maybe I can try to have, initial conversation. It doesn't, what the MHFA training does not make you, it does not make you a certified therapist or counselor or professional. It helps you, like I said, the same thing with CPR. If you get the CPR training, it doesn't make you a doctor, right? But it does help you to sustain, doing chest compressions, right? You're sustaining them until the ambulance get there. They're the professionals. They're going to come in, continue the CPR, and take them to the closest hospital. So, I just want you to be mindful that when you do these trainings, it's to bring greater awareness and engagement in a sense, right? Allows you to have those conversations amongst other educators, right? It could be, the teacher that has, one period with a child saying, hey, I've noticed this behavior in this child, and shares that with another educator, and they might pay attention to it. And they may say, like, you know what, you are right. I did notice this behavior um, from this student. Maybe we need to go talk to a guidance counselor or talk to their, set up maybe meet with the parents and see if everything's okay at home, right? And again, it's possible that and again, it's a sensitive conversation if you're bringing into the parents, right? The parents may not share what's going on at home. We don't know, you know, there's a lot of the factors that go into it, right? We haven't even there issue, there's stigma behind domestic violence in the Muslim community. People aren't openly talking about that, and those can, you know, trigger changes in mental health behavior in a child and things like that. Again, it does not mean that every child that is having behavioral issues or whatever is, experiencing some sort of domestic violence at home or any sort of abuse or anything like that. It's very complex, but it helps you to identify and understand what could be, what sort of things could be behind that. These are very, very good questions. So, thank you for sharing them. Any other questions? Maybe a question for the group. How many of you have actually heard, and you can feel free to respond in the chat, but how many of you have actually heard of the mental health first aid training before we had our webinar today? Good, a few of you. Oh, well, that's good. And I guess that's wonderful. Yeah, again, I want to keep it open for any additional questions. Fantastic, Samar. You know, if you want to unmute your mic real quick, do you want to share what you've thought about the training? Oh, are they able to unmute themselves?
No, no.
Oh, okay. Sorry about that. Well, Samar, you know, thank you. And if you want to share in the chat what you thought about it, that would be appreciated.
Yeah, right now she can talk. I have given
Oh,
her permission.
okay, fantastic. Did we lose Samar? That's
Oh.
okay. Oh, okay.
Oh, I can. Oh, you can hear me now. Yeah,
Yes,
I
I can.
did have that training actually, and our teachers in Sunday school also. We invited the same organization to give them the same training. In matter of fact, it was very uh, eye-opening to a lot of things. It helps a lot with our profession to be more inclusive, more understanding, and more aware of what's going on. It helps to go to the root and helps to, uh, have better understanding where is the behavior coming from or how can you uh, deal with it, whether it's with the student itself or the family or the whole community together. I did had also the other training for preventing from suicide, uh, which is also was great help. Uh, you know, always being aware of mental illness and disability is great help if we are in the teaching field.
Jazakumullah khair, Samar, for that. The question I just got is, have you provided this training in schools, organizations in South Florida? I know we've done it in Florida, but I'm not sure if it was South Florida or not. Any other questions or comments? Feel free to share the comments either in the chat or the Q&A forum.
If anyone wants to talk, just raise your hand. I will give permission to talk.
As we're waiting for if individuals want to chime in. Let me also kind of talk about like some of the programs that AMHP is with our mental health program that we're working on expanding into. So right now we have some a project that we're working on mental health support for refugees. That's one of the things that is very important, and we're looking to continue that work, and that will actually involve creating a module for educating medical students to better deal with immigrants and refugees that are coming to the US. Yes, the director has a question.
Looks like someone has their hand raised. Director of ICOSF. See, brother. Okay, you should be. Let's see here.
Yeah, I think you should be able to talk because I have given permission to talk.
Yeah, I think he's unmuted, I think. Well, no.
Yeah.
He's unmuted, so I'm not sure. Maybe he's having some technical difficulties, maybe.
You can always write your questions in the chat if you have any difficulties.
If you guys want to add in your chat, just maybe the state or location you guys are joining from, that kind of gives me a good feel of where everyone's from. Fantastic. Oh wow, Arkansas. It looks like I don't think we've done a training in Arkansas. We would love to do one there. Iowa, fantastic. California, yes. Georgia. Welcome everyone. Looks like I think the only Arkansas and Iowa are states that we haven't done trainings in. Welcome. This just goes to show like across the board. And I know everyone's, cultural and ethnic backgrounds are diverse. So, and that's what alhamdulillah makes, the Muslim community so beautiful and wonderful. But, at the same time, we were talking about just the challenges towards getting mental health help. New Jersey, wonderful. And also in the presentation we mentioned, like, for some of these larger areas, using, looking at California and New Jersey, there is a lot of programs and things that are there that really bring attention to the Muslim mental health. But when we're talking about rural areas, where the Muslim population isn't as robust, those areas, access to help it tends to be a little bit more challenging. So in doing these sort of trainings, it gives you an additional tool to be supportive of your community and engaging in those very difficult conversations. Oh, I think we have another question. Do you have, okay, so the question from the director is, do you have what other teachers have said about the training so we can understand how they benefited from it? I know Samra had kind of shared some, I'm sorry, not Samra, Samar shared a few of her thoughts because she went through the training last year. I can talk to the I believe we do collect feedback, so I can see what specifically teachers have said about it. But I know that just in general, there have been comments in terms of, this is a very useful training and helping people navigate those difficult conversations, and even being, and having those sensitivities towards, having conversations, identifying, individuals who may be struggling. So yeah, again, like, please feel free to shoot me an email. I'd be happy to provide you with more information. Any other questions?
So brother Shafiq, if there's no question, I can share that what we've done to kind of maybe give some ideas as to how to sometimes, because I know that to these kinds of trainings are very helpful because we've done it. But what we've done it is we did it. We made sure that we had all of our team leaders as well as administrators all join in, but also we selected folks, leaders from the other masajids and other schools to also join us and come and be part of the training that we held at our center. And I think that's one way of doing it also is collaborating with other schools in your area and then do this training. It's very helpful because it's a lot of, we learned a lot about a lot of misconceptions that we had, like as people, that we hear about, about mental health, about kids' behaviors, what certain behaviors, what they entail, and all of that is very helpful, because some of these things are, realities. Some of them are assumptions. Some of them are based on cultural, biases and stuff like that, or at least cultural leanings. So I think it's good to go through this training to kind of at least have an idea about what it is, what are the signs, and what is your responsibility as a teacher, as an administrator, as a leader. What is your responsibility when it comes to these kinds of situations, right? You're not a trained professional. I'm not a trained professional, so I cannot really do intervention. But it does outline steps that you can take to address issues that arise while you are doing your duties.
Yeah, exactly. And thank you for that. Yeah, because this is the MHFA training is a nice guidebook in a sense, like it provides us guidance, right? Like I said, I've worked in public health for over 15 years, but I'm not a therapist. And for me to get this sort of training, it helps me to navigate, what do I do, right? If I see this happening. Or if I know, if I have a friend or an individual that I know is going through a difficult time, I mean, I would say a difficult time, they might be suffering from like severe depression or anxiety or anything else. It helps me to understand and approach it in a, sensitive way, right? Again, we can't go at it and say like, oh, you should do this, you should do this, you should do this. But really, how do you have that conversation? And it provides you with those tools to have, at your disposal. Yeah, so Henry, thank you so much for that. How does your training relate to other Muslim mental health organizations? So, as I mentioned, the mental health first aid training is evidence-based. It is a standardized training that was developed by the National Council for Mental Well-being. So they created this curriculum. So when we do this training with your organization, what happens is, we'll set up, whatever date it is. And like Henry said, you can even invite your other local masajids or other local schools, because we try to have a good, diverse and good training session. We try to have, at least if we do it in person, a minimum of 20 individuals. If we do it virtually, a minimum of 15 registrants is important to have. And in doing so, you are able to, we get these textbooks that you can use as future reference. And so yeah, it's a standardized material. But where there's a difference is that we are Muslims teaching the Muslim, Muslim leaders, teachers, educators, etc. Because if we had someone who wasn't Muslim, it's very hard to teach it in that lens, because they don't have a context of what sort of Muslim stigmas are in the Muslim community, or the cultural differences, right? So that's where we bring a unique perspective to this training. While there isn't a standardized, this is how you teach this training for Muslims, that's not built into the standard, but we bring that perspective to us to help guide those conversations during the training about how we handle certain situations. I hope that answered your question. Any other questions? And the reality is, we all know someone who is affected by mental health, and that's why it's very important that we do things that are promote mental well-being, right? When we talk about mental illness, it affects the mind. And when it affects the mind, it can have impact on the body, right? We see in some people that they lose their appetite, they're not caring about themselves and things like that. So there are ways in which we can, have those discussions in our community about mental well-being, right? How do we ensure that our minds are clear, right? Right now, somebody had asked a question about social media. Right now, our youth are watching a genocide that's going on live on their phones on a minute by minute basis, second by second basis. They're seeing unfiltered images that can potentially affect their well-being, right? We need to be able to have those conversations, be able to identify, how this is affecting our youth. And in doing so, we have to be sensitive to um, addressing it in a sensitive manner. We can't just snatch away their phone and be like, you can't, you're grounded from this, right? It's going to create more issues, more deeper issues. But and at the same time, is if we are to have those conversations with children and young adolescents who are seeing this and are asking us questions, how do we navigate those questions? It is very difficult, and we want to bring it from, an Islamic perspective. And that's why we want to have trainings with our imams, right? They will, when they have this conversation, when they give khutbas or halakas about what's going on in Palestine or in Sudan and in China and other places where there's, severe oppression. All of this news and information affects the psyche of our youth, right? So we want to be able to have those, have conversations and talk about what affects our mental well-being, right? It is depressing to see these images. It is depressing and causing, and right now with the state of politics in this country, there's a lot of anxiety, right? We have Muslim community members who are immigrants. They might be in the process of getting their green card. So, and with all these sort of illegal activities that are being perpetrated by our government, a government that's supposed to be, serving the people, now is doing the opposite. It's scary for children. It's scary for adults. And so how do we have that conversations? And so this is where that mental health first aid training will, provides us with an empowering tool to understand, how can we have constructive conversations and identify and assist people in getting the help that they need. And while we wait on questions, if anyone has any comments they want to share, please feel free to use the chat. Our because it helps, with talking about the important things.
But I think there is no more questions. I think we can conclude our webinar.
Okay, fantastic. Again, I shared my email address. I'm happy to address any more questions that you might have after this webinar. Thank you again for listening. I really appreciate it.
Absolutely. Thank you very much, Brother Shafiq. And I would like to thank everyone who attended. On behalf of WISER, as well as American Muslim health professionals. We appreciate everybody seeing this topic as a topic that is worthy of your attention. And I urge everyone, on behalf of WISER, urge all of those who are dealing with kids, as part of their responsibilities, to take advantage of these trainings, because you do interact with folks who are dealing with these on a more regular basis than we are aware. So Jazakumullah khairan, and he shared his email address. Anyone who's interested can reach out to them directly. And please tune in also for more webinars from WISER. We'll provide as many as we can across different areas of expertise. Inshallah, we'll find experts in those areas, in those fields, bring those trainings and webinars to you, inshallah, as much as we can. Jazakumullah khair, and thank you all for joining.
Really quickly, I want to add one thing is, in this country, educators are very much underappreciated. I want everyone who joined today to understand that, as educators, you have a very difficult and challenging job. So I just want to say I appreciate all the things that you guys do as educators. My older sister is an educator, so I have a very deep appreciation for everything that you do. So Jazakallah khair. I hope that AMP can be supportive to our educators in the Islamic schools and weekend schools as well. So inshallah, Jazakallah khair.
Inshallah. Wa iyyakum. Thank you. Assalamu alaikum.
Wa alaikum assalam.